Edutainment Studios welcomes you to Age-Related Macular Degeneration, Understanding It and Living with It. This module is part 4 of a 5-part series on age-related macular degeneration. In some people, AMD, or age-related macular degeneration, advances so slowly that vision loss does not occur for a long time, while in others, the disease progresses faster and may lead to a loss of vision in one or both eyes. As it progresses, a blurred area near the center of vision is a common symptom. Over time, this blurred area may grow larger, or you may develop blank spots in your central vision. Objects also may not appear to be as bright as they used to be. AMD by itself does not lead to complete blindness with no ability to see. However, the loss of central vision in AMD can interfere with simple everyday activities, such as the ability to see faces, drive, read, write, or do close-up work, such as cooking or fixing things around the house. In this course, the objective is to help you learn how macular degeneration is tested. If you notice a change in your central vision, you should have your eyes checked by an ophthalmologist. This type of doctor specializes in the medical and surgical care of the eyes and visual system and the prevention of eye disease and injury. To help diagnose macular degeneration, an ophthalmologist or optometrist will perform a comprehensive eye exam that may include the following tests: autofluorescence. Eye care professionals use autofluorescence imaging to study the retina and measure the progression of geographic atrophy in people with advanced dry AMD. Doctors can use this technique to monitor the retinal pigment epithelium, or RPE, which is the deepest layer of the retina. RPE cells maintain the function of the light-sensitive cells in the retina that allow us to see. In dry AMD, the RPE layer of the retina thins, eventually causing the death of light-sensitive cells and leading to visual impairment. This process is called geographic atrophy, and it occurs in the advanced stage of dry AMD. What is a dilated eye exam? In order to view the back of your retina, the doctor dilates your pupils with eye drops. Dilation allows the doctor to study the retina for signs of disease and determine if there is any optic nerve damage. Fundoscopy, or ophthalmoscopy, is performed after dilating the pupil. The doctor aims a bright beam of light into your eye to check for problems in specific areas: the retina, which is the nerve layer lining the back of the eye; the choroid, which is a thin layer connecting blood vessels and nerves to other parts of the eye; the blood vessels, which carry oxygen and nutrients within the retina; and the optic disc, which is a small circular area in the back of the eye where the optic nerve connects to the retina. A visual acuity test, or eye chart test. This measures your sight from various distances. Fundus photography may also be used in addition to physically looking into the dilated eye. After dilating the pupil, the doctor focuses light through the cornea, pupil, and lens. He or she uses a customized camera to photograph the back of the eye to look for signs of disease in the retina, macula, and optic nerve. This process can also measure changes in the eye between visits. The retina is the light-sensitive inner layer of the eye where vision begins. The macula is the specialized center of the retina responsible for sight in the center of vision. The optic nerve carries sensory information related to vision from the retina to the brain. If the doctor suspects that you may have the wet type of AMD, this test can be conducted to detect leaking blood vessels. The doctor injects fluorescent dye into your arm and traces it through the blood vessels in the retina, where the appearance of fluorescent patches can reveal leakage. Optical coherence tomography, or OCT, is a non-invasive technique to image the retina. OCT produces cross-sectional images of the retina so that the different layers and their thicknesses can be measured. When the doctor suspects advanced dry AMD, this technique can identify regions of the retina that are thinning, indicating the presence of geographic atrophy. Doctors routinely use this test to assess the retina's response to various treatments. Tonometry measures the pressure inside the eye. The doctor will give you a numbing eye drop before this test. The home monitoring Amsler grid can help detect early signs of retinal disease and also monitor changes in vision after an AMD diagnosis. During an eye exam, the eye care professional may ask you to look at an Amsler grid to check for AMD. The grid resembles graph paper in which straight lines intersect at right angles. You will cover one eye and stare at a black dot in the center of the grid. While staring at the dot, if the straight lines in the grid appear wavy or are missing, it could be a sign of AMD. The grid should not in any way substitute for the advice of a qualified healthcare professional. It is not intended to constitute medical advice. However, they may use it for at-home monitoring. You can view or download a PDF of the Amsler grid eye test. The 4C Home Monitoring Device is the first FDA-cleared device for patients with dry AMD to monitor the disease at home. It is now a Medicare-covered service for patients enrolled in Medicare across the U.S. and who meet the eligibility criteria for dry AMD at high risk for converting to wet AMD. The device is designed to be used daily and takes approximately 3 minutes per eye. When used daily, the 4C Home Monitor detects any changes before you would even notice and allows the doctor to monitor your vision for any changes that take place between regularly scheduled exams. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 4 of 5 on age-related macular degeneration. And please join us for Part 5.